There's a lot of information over the past few weeks coming out regarding this new coronavirus. We know it's come out from China and we know it's now affected the whole world. In this brief video, I'm going to show you a quick 5-point plan of what you could do to minimize the risk of you getting infected with the coronavirus. Avoid individuals who have got the flu or are suffering with a cold. The coronavirus is transmitted through droplets and is not airborne, and therefore you have to come into contact with these droplets that are infected with the virus before you can catch that virus. If you have any underlying illnesses like asthma, diabetes, heart problems, make sure that they are now under control, because these illnesses can make your system weaker, making you more vulnerable to picking up the virus. All you need is something as simple as one of these. A packet of tissues. If you're going to sneeze, sneeze into a tissue, catch it, and then put it in the bin. There's a lot of discussion at the moment around whether masks are effective with regard to the coronavirus. I've seen people walking around with masks like these, the surgical masks, and I've also seen people wearing these, which are the kind of masks that builders wear. Neither of those masks are effective. They don't have a good seal, and if anything, all you will end up doing is touching your face more often, which will end up putting you at higher risk of getting an infection. There are specialist masks, which are N95 respirators, but they're very difficult to wear. You need to be trained how to use them, and considering most of us would be talking and eating during the daytime, you can't wear the mask right through the day. And most effective thing you can do to combat the coronavirus is to wash your hands with soap and water. The surface of the virus is a fatty surface, and soap and water manages to break down the virus and kill it. As well as soap and water, if you are out and about, it's useful to carry one of these little bottles, which will help clean your hands if you feel that you've been in contact with an area that may be infected. I'm going to show you how to clean your hands. It's the same technique with this gel as it is with soap and water. This is the technique to clean your hands with soap or water or with gel. Showing you with the gel, take a bit of gel in your hand. Step 1, rub the palms together. Step 2, fingers on both sides, back of the hands. Step 3, interlock the fingers, rubbing the hands together. Step 4, make sure your nails are clean. Step 5, do the thumbs on both sides. And finally, to finish off, clean the palms of your hands on both sides. With the coronavirus, it is quite easy to transmit it if you are infected. If there is any chance that you have any flu-like symptoms, my advice would be to avoid going to communal areas such as mosques, temples, synagogues and other places of worship where you would be in close contact with the rest of the congregation. Also avoid public transport, and at this time of the year, try and avoid going to anywhere like care homes and nursing homes where there are elderly people who may catch the virus from you. Now, if you think you have a viral infection, do not go to your GP surgery and do not go to the A&E department at your local hospital. Going to either the GP or the hospital will put everybody who works in those institutions at risk, but it will also put other patients who are already there with illnesses at risk. From home, ring 111, who will take your history and provide you advice on what you should do next.